time shouldn't be the metric. Complexity needs to be the metric. So what are those things that determine that? And that's for us to
I guess that's
participate.
outcomes. When are the outcomes delivered?
See, the
Well, I
outcomes, though,
don't
are
think,
not totally in our hands. That's the other
Okay.
challenge. But whereas the outcomes in a hip replacement they've chosen to make the outcomes in their hands. So the outcomes are no infection after surgery. Right? They haven't chosen the outcome to be can walk well after surgery. Okay. So if we're going to choose outcomes, which I don't disagree with, George, we can't choose patient well-being as the outcome.
Mhm.
See what I mean? We have to choose our outcomes wisely.
so I think outcomes are very difficult because we're dealing with human beings and every person's different in multiple ways. And some are going to accept the flu shot, some are not. Some are going to take the COVID shot, some are not. Some are going to listen when I go, your kid cannot continue to gain 30 pounds a year. It's not possible. What should we do about it? And they come back, the child loses 10 pounds just with that. Others are like, no, he's okay. There's nothing I can do about it.
So outcomes need to be what we can do. So
What
we
can
can
fix.
have conversations. We can offer things. That's all we can do.
Yeah. And so to me, I think the conversation starts with we need to recruit the best into the specialty of pediatrics. That means that they have to be paid $350,000 a year. And I'm not ashamed to say that because that's what the average physician makes in the US.
I agree with you.
If we can't pay that, then we're not going to get the best because people can make $1,000,
George and I are
$2,000.
coughing and laughing because we would love to make that, wouldn't we, George? Wouldn't that be great? Let's make that every year.
But there's lawyers making $1,000 to $2,500 an hour.
Right.
Okay. There's no one's ashamed of that. And then you have to limit the number of patients you can see in a day because it's about relationship building and time, not in the sense that every patient is going to take me 45 minutes, but I might have to read about this kid because I'm not familiar with his condition. I need that time. I can't be in a treadmill of volume seeing 5 patients an hour because then my quality stinks because I'm just running from room to room trying to get them out the door without making a mistake.
Exactly.
And so until we talk about minimum payment to attract the best of the best and limited number of patients a day so that we have the time to do the relationship building and do the thinking, we're not going to move the needle in any direction. And unfortunately, to my great frustration, that conversation barely ever happens. No one wants to talk about that. They want to talk about value-based medicine, which is an acronym for how do we cut down the cost of taking care of chronically ill people who are at the end of stage and not the investment that our youth needs to be able to be successful.
I think pediatricians also, though, need to embrace the value of extenders more. And I think that pediatricians they're happy to have a nurse practitioner or PA in their office doing work that way. And I think if we are going to be able to, in a short-term way, recruit more pediatricians, then I think we need to consider the value of the European model where quote unquote GPs see everybody, see the garden variety cases, and pediatricians are specialists. And the nurse practitioners see everybody typical. And then we have maybe 8 patients a day instead who are the more challenging cases. And then we do get to spend more time with those patients.
The only reason I would push back against that, because that model is used in Latin America quite a bit, and you don't need a nurse practitioner. A good nurse and a good nutritionist could do most well-child exams as long as everything is perfect. Child's gaining the right amount of weight. He's on the right path on the growth curves. The ASQs are normal. An educator can tell him about the vaccine.